Hi, my name is Kayla Berge, and this is my presentation on how to prepare and administer a GLP-1 medication, as well as the benefits that come with them. GLP-1s mimic a natural hormone in your body that is called glucagon-like peptide 1. So they help control blood sugar as well as your appetite, so it's going to help reduce that. And it also is going to help support weight loss. These medications are commonly used for type 2 diabetes, and they're increasingly prescribed for metabolic health and obesity management. So GLP-1 medications not only lower your blood glucose levels, but they also slow gastric emptying. So when you slow your gastric emptying, that basically helps you feel fuller longer. When you feel fuller longer, this is going to help make sure that you're not eating as much, which will in turn help with overall weight loss. The weight loss is going to help reduce your risk of heart disease, it's going to improve blood pressure, and it's also going to lower inflammation in the body. So before you begin with administration of a GLP-1 medication, you need to make sure that you have all of your supplies. So typically whenever it comes to getting all supplies ready, you need to make sure you have your GLP-1 medication, which may come either in a pen or it may come in a vial. And then you need to make sure, if it does come in a vial, you have a syringe that has an adequate gauged needle to it, as well as alcohol swabs, and then maybe a Band-Aid. Make sure that you have a sharps container or somewhere safe that you can dispose of the needle afterwards, and make sure, most importantly, a clean workspace as well as washing your hands. So after we've gathered all of our supplies, the next thing to do is to pick our injection site. So we have three main areas for our injection options, and that includes our thighs, the back of the arms, and then we can also choose our stomach. If you do decide to choose your stomach, you need to make sure to stay at least 2 inches away from your belly button. So now that we have gathered all of our supplies and we have cleansed our injection site, the next thing to do is to prepare our GLP-1 medication itself. So for this example, I will be discussing a vial. So make sure that you have your vial ready, and then you are going to use an alcohol swab and clean the top of the vial off. This is going to make sure that we are preventing any infection. So now that our vial is cleaned off, I am going to grab our syringe here, and we are going to decap this, and then we are going to insert very carefully right into the rubber stopper of the medication vial. The next thing to do is to pull up based off of your prescription. So it should say on your vial, and then you are going to pull up the exact amount that the provider has ordered for you. So in this case, I'm going to pull up 50 units. And then after I'm finished, remove it directly out from underneath the vial, and then I'm going to safely decap or recap my needle until I'm ready for it. So now we are ready to inject our medication. So we need to make sure that we uncap our needle back, and then with our cleansed site, we are going to hold the syringe at a 90-degree angle, and we're going to insert the medication steadily into the injection site. You need to make sure to push all of the medication into the injection site before you remove the needle from the skin. When you're ready to remove the needle, remove it straight out from your injection site. When you're finished with that, make sure that you dispose of the needle or the syringe in a sharps container. A couple important considerations for your injections are making sure that we are not injecting the medication into a muscle or a vein. So we are doing this by making sure that we're using either a 5/16 or a 1/2 inch needle, and in conjunction with pinching the subcutaneous fat that we are putting the medication into, that's going to ensure that we're not being injected into the muscle or a vein. Make sure that you store the medication as it's directed by the manufacturer, but typically it is required to store the medication in a refrigerator. It's always important to take in consideration the side effects that you may have with the medication. So, a couple of the most common side effects that a patient may see while they're on this medication include nausea, decreased appetite, mild bloating, or constipation. So, these typically will improve as your body adjusts to the medication, but a few side effects that you need to make sure to inform your provider instantly if you have these are severe abdominal pain, persistent vomiting, as well as signs of dehydration. Here are the references that I've used for my video today, and I hope that we feel comfortable and confident with our GLP-1 medications as well as safe administration. Thank you for listening.